Hello, everyone from St. John's, Newfoundland and Labrador. My name is Janet Herron, and I am an Alumni Engagement Officer here at Memorial and your host for today's event. I hope you are all well and safe as we live through and move forward these very strange days. I'm here with Jeremy MacDonald, a Memorial alumnus, pharmacist, and Memorial staff member at the Medication Therapy Services MTS Clinic in Memorial School of Pharmacy. He will be explaining what vaccines are, how they work, and why you should get one to protect yourself and others from COVID-19. I know those of you attending can't see who else is in the room for the event, but we do have a full house. We have over 160 registrants, and we have over 65 attendees right now and more joining every second. So we're very happy and pleased about that. We will begin today's event officially with a land acknowledgement.
And the island of Newfoundland.
Sorry, I gotta bring that to the beginning.
We respectfully acknowledge the territory in which Memorial St. John's campus is situated as the ancestral homelands of the Beothuk, and the island of Newfoundland as the ancestral homelands of the Mi'kmaq and Beothuk. We would also like to recognise the Inuit of Nunatsiavut and Nunatuhavut and the Innu of Nitassinan and their ancestors as the original people of Labrador. We strive for respectful relationships with all of the peoples of this province as we search for collective healing and true reconciliation and honour this beautiful land together. Please also recognise the peoples and their ancestors whose ancestral homelands are those on which your own institutions are situated.
At the Office of Alumni Engagement, we are focused on offering many ways for you to connect with Memorial from anywhere in the world and are working diligently to create opportunities to celebrate, socialize, mentor, learn, and advance both your career and improve your life. Embarking on new and exciting ways to build relationships is vital to our evolution as an institution. You, our alumni and friends, along with our faculty and staff members, are our greatest ambassadors. Together, you encompass a worldwide community of professionals, leaders, and change makers who are advancing the reputation of our university, our province, and our world. You are a worldwide community of professionals, leaders, and change makers. Oh, sorry, I'm repeating myself. Please consider getting involved with our programming. There are mentoring opportunities with 10,000 coffees, occasions to meet up with Newfoundland and Labrador expats through Global NL, and Coastlines, our online book club, features Newfoundland and Labrador authors who are also Memorial alumni. You can find more details about all these initiatives on our website, www.mun.ca/alumni. Thank you so much for joining us today for our discussion about vaccines in partnership with the School of Pharmacy. Just a few housekeeping issues. For those of you new to WebEx, there is a layout button towards the top right-hand side of your screen that gives you options on how you'd like to view today's presentation. We'll be following Jeremy's presentation with a Q&A. I will be monitoring both the chat and the Q&A function for questions. So please post in there and try to keep your questions short. And I encourage you, if you have a question, to post it as soon as possible and not to leave them till the last minute. A note about content, a reminder that Jeremy is unable to provide medical advice for specific individuals. And also, just like to note that with the evolving information and evidence coming out in regards to COVID-19 vaccines, the situation is changing every day, and it can be difficult for healthcare providers like Jeremy to stay up to date on all the new information. He will, however, answer your questions today to the very best of his ability. Following this presentation, we will email all registrants with links to the latest official vaccine info. And a final reminder that this session is being recorded, and you will receive a link to the event in a follow-up email, along with some additional resources and a PDF version of today's presentation. It is my great pleasure to introduce you to our guest today. Originally from Burgeo, Jeremy MacDonald grew up knowing the vital role pharmacists can play in a community. He obtained a BSc Pharmacy from Memorial in 2017 and is currently enrolled in Memorial's PharmD for Working Professionals program. Jeremy has worked as a community pharmacist in Western and Eastern Newfoundland, as well as on the Great Northern Peninsula, and is currently a pharmacist at Memorial University School of Pharmacy's Medication Therapy Services Clinic. The MTS Clinic is a non-dispensing pharmacy located in St. John's that provides comprehensive medication therapy assessments to people all across the province and has recently been involved with flu vaccine clinics. With pharmacists increasing involvement in vaccine rollouts, Jeremy has taken an interest in the public health needs of Newfoundlanders and Labradorians and the role pharmacists play in increasing knowledge and access to public health resources such as COVID-19 vaccines. And now, with no further ado, Jeremy will begin the presentation, and I'm going to hand the ball to him and he will take it away.
Great, thank you, Janet, for the introduction, and thank you everyone for attending today's presentation. Vaccines are a very hot topic, in today's news and in the media, and certainly something that we all need to be informed about to make the best decisions for our own health. I'd also like to take this moment to thank everyone for everything they've done during the pandemic. We've made a lot of sacrifices, and we've had to all do our part to work together to help control COVID-19. So my hopes for today is with Vaccines 101, you'll be able to, get a better understanding of vaccines and how they work, and hopefully feel more comfortable with getting your vaccine. So today's learning objectives, my hopes is by the end of this presentation, you'll be familiar with the basics of your immune system and how vaccines work in your body to protect you from diseases, the differences between the vaccines available in Canada, what to do to prepare for your COVID-19 immunization and what to do following your immunization, as well as we'll talk about vaccine hesitancy and what it is and why some people may be reluctant to get their vaccine. So COVID-19, certainly a topic that we hear every day. I actually don't remember what we used to talk about before COVID-19 kind of struck last March or last February. It's certainly a big conversation and discussion. And this image in the background here is a picture of the virus. You may see it, in the media or in pictures on the webs, but it's a picture of the virus that causes the disease COVID-19. So it's SARS-CoV-2, okay? And COVID-19 itself, what that stands for, the CO is for corona, VI is for virus, and D is for disease. So it's the coronavirus disease of 2019, and that's when it was first identified by the World Health Organization. So in terms of the parts of a coronavirus, on the outside of the virus, we have these different proteins, these different structures that help the virus attach to our cells and help it to get in. And once it's inside, that allows the genetic information to be released, and then the virus to make more copies of itself, and that would be how the virus would take a hold of our bodies and overrun our immune system. So the word corona comes from the Latin word corona, which means crown. And that's just when, researchers look at the coronavirus under a microscope, it looks like a crown. And fun fact, I actually didn't know this before looking up the word, but if you look at any Corona beers, there is a Corona symbol. That is their logo that you'll see. Okay, so in terms of our immune system, how does our immune system work to protect us from this virus? Whether we're exposed to the virus for the first time or we get a vaccine that will protect us, from the virus. So on the screen here, you'll see 4 different pathogens. 3 of these we're very familiar with. So there's measles, there's chickenpox, and there's flu or the influenza virus. So me personally, I'm much more familiar with chickenpox and flu than I am with measles. Measles has been a disease that we've been able to control with vaccines, okay? On the outsides of these different pathogens or these different diseases, you'll see these things called antigens. And the antigens are kind of like those proteins I was talking about earlier that's on the outside of the coronavirus. These are individual to the disease themselves. So our bodies needs to create these different antibodies that you'll see here that identify these different diseases that enter our bodies and then tell our immune system that we need to defeat this virus or this disease before it takes over. So you'll see here with the measles, the shapelet matches up with the pathogen here, and then over here the the one for chickenpox, it matches the one for chickenpox, and same with the flu. So there's all these individual ones as it's very specified to the pathogen. Then we have a new pathogen. So in this case, this is COVID-19, and there aren't any antibodies to help our bodies identify this disease early, and then our bodies to have an immune response that will be able to fight off the disease before it replicates, okay? And how we get these antibodies, there's typically two ways. So, with measles, we receive a vaccine. So that would be the MMR vaccine that we would receive from our usual public health vaccination schedules. But then chickenpox, I know I personally didn't get a vaccine for chickenpox, and I was directly exposed to it. So by being directly exposed to chickenpox, I ended up getting the disease, and my body then developed antibodies for it. With the flu, we had the flu shot every year just because the strands change typically, annually, and that's why there's an annual flu shot. So when it comes to COVID-19, because it is a new virus, our body will either have to be exposed to the virus and therefore not have, that first line of defense all ready to go, or we'll get the vaccine, which will help our bodies to build these antibodies to identify the coronavirus so that if we do get, if we come in contact with COVID-19, our bodies will know how to fight it so that, we can decrease our risk of, being hospitalized or getting severe infection. Vaccines, again, very big topic. We're looking at vaccinating Newfoundland and Labrador at the moment and getting vaccines across Canada, but it's really important that, long term, we need to get the whole world vaccinated to really, get this disease under control. So how vaccines work, so this image kind of goes along with the earlier one. So as you can see, the little antigens on the outside of the vaccine are the shape of the virus itself. So this, when it's injected into our body, our body recognizes it as a foreign object that's in there, and it creates new antibodies that will protect us if we actually do come in contact with COVID-19. So, vaccines work. If you look historically over, the last 50 years, we've had great development in science and in medicine, and we've been able to control many diseases with vaccines. So you look at whooping cough, measles, chickenpox, mumps, these have been greatly reduced. Years ago, there were, tens of thousands of cases, and now, that's a 93 to 99% reduction in the cases that we see nowadays. And if you look at diphtheria and polio, the last 5 years, there have been no cases. So we've basically wiped out these diseases, and vaccines do work, and the next big disease that we need to take control of is COVID-19 in reducing its burden on society. Okay, so what type of COVID-19 vaccines are there? The main two that you'll see are the mRNA vaccines and the viral vector vaccines, okay? So mRNA vaccines are, it's a newer vaccine to the public. A big concern some people have is that these are new types of vaccines, but really the research that has been going into mRNA has been going on for years. And the earliest I could find actually was 1971, 50 years ago. Researchers were looking at mRNA vaccines. And, over the years, they had to look at the differences in, how to get it stable and how to get it into the body and how to, once it's in the body, how do we get it into the cells to work? So, research is piggybacked on top of research on top of research. And, recently before the pandemic started, our technology brought us to a point that researchers were able to start developing these mRNA vaccines and have them effective. And it's almost timely that as the pandemic started, that we actually had this technology ready to go. And it's really, really shown, over the past, 5 months now that vaccines have been getting into people's arms, and we are seeing some benefit from it. So the two mRNA vaccines that are available in Canada are the Pfizer-BioNTech and the Moderna vaccine. So in terms of these two vaccines, Pfizer has been recently approved for anyone 12 and up, and in Newfoundland and Labrador as of yesterday, anyone 12 and up can get a vaccine. So if someone was, say, between the ages of 12 and 17, so anyone's children here in the call, or anyone's grandchildren, certainly your child or grandchild will be getting the Pfizer vaccine if they fall into that age category. And then we have the Moderna vaccine, which is currently indicated for anyone that's the age of 18 and up. Okay, so how do mRNA vaccines work in the body? So mRNA stands for messenger ribonucleic acid. So what it is essentially what the first letter says. It's the messenger. So when you receive a vaccine, that vaccine enters something called mRNA, and it sends a message to your cells to create those proteins that are on the outside of the coronavirus, okay? It gives a message to your cells. Once it delivers that message, the mRNA is actually broken down, and it's not, it doesn't take very long before that actually leaves your system. And what you're left with then are cells that are creating these spike proteins on the outside of our cells that our bodies will then identify and create antibodies for, so that when we do come in contact with COVID-19, or if we come in contact with COVID-19, our body kind of knows how to already fight off that infection. The other main type of vaccine that's approved in Canada are viral vector vaccines. So that would be the AstraZeneca vaccine, or the Janssen or J&J vaccine that you'll hear of. I will note Janssen currently isn't being administered in Canada, despite it being approved. The reason for that is just some quality control issues that Health Canada is currently working out, with the company. In terms of the age that they're indicated for, they are recommended currently for 30 plus across Canada, but that will vary based on the province that you're in, okay? So I know some provinces currently aren't giving AstraZeneca anymore as a first dose. It really depends on the province that you're in. So how do viral vector vaccines work versus an mRNA? The mechanism is similar, but how this one works is they insert a vector into your body, and essentially what a vector is it's like a cousin of COVID-19. It's a weakened form of the virus. It's a non-harmful form of the virus that has these spike proteins present on the outside. And again, once it enters, our body then recognizes that there are these proteins on the outside, and they notice that it's something different and it's something foreign, and that they need to create antibodies for it. And then once you get antibodies, again, it will protect you, so that when you come into contact with COVID-19, that your body will have that line of defense. And really the main difference here is an mRNA vaccine doesn't inject those proteins in your body. It injects something that gives instructions to your body. It makes your body kind of do its own work to make these proteins, so that your body recognizes it and kills it off. So this slide just kind of recaps everything that we talked about so far. Just saying that vaccines train our immune system with a harmless form of the virus. And this is called an adaptive immune response. And the goal here is so that our bodies can get something called immune memory, or long-term immunity. So that, again, someday, if we did come in contact with COVID, we already have this army of B cells and T cells and different antibodies ready to go, so that if this thing, just think of COVID-19 as a wanted poster, and once COVID-19 enters and our line of defense identifies it, they'll fight it off and allow us to fight the virus before it overcomes our immune system. So in terms of which vaccine you can get, you're gonna see a lot of different percentages thrown out. You might see, this one's 80% effective, this one's 94.5% effective. Which one should I get? Which one's the best one for me to get? When thinking about that, what I tell people is to think about, what's our main goal with the vaccine? Which vaccine will protect you from severe disease? Which vaccine will help keep you out of the hospital from COVID-19 infection? Which vaccine will help us move forward through this pandemic? And when you ask those questions, really any of the vaccines will help you do that. So typically the best vaccine for you to get right now is the one that you're offered. Okay, so it's the one that your age is indicated for, and it's the one that's available through public health. And saying that, that was very much the message, the past couple months with the vaccines. I am seeing a bit of a shift now towards the mRNA vaccines, and that's typically due to the availability of them. We're getting a lot of shipments of Moderna vaccine and Pfizer vaccine, and because we're getting all these vaccines, those are being administered to those that the ages are indicated for. But certainly, if you got the AstraZeneca vaccine and you're feeling uncertain about that decision in the past month, for those that have received vaccine already, you certainly did not make the wrong decision. You made the right decision in getting the vaccine that was available for you at that time. You now have a vaccine in you that's giving you protection, so that if you did come into contact with COVID, you do have that protection. Okay, so switching gears here, I just want to rewind back to March 2020. On the 11th of March, that's when the World Health Organization declared that we are in a global pandemic. Of course, COVID was in circulation prior to that, as far back as December, but this was the day that I say kind of the world changed and we started shifting gears. And it kind of seems like a long time ago, but it also seems like a blink of an eye, and we're already in March 2021. So. Some questions or some concerns that I get about the vaccines are that they were developed too quickly, and I will say yes, that it's a miracle actually that we have so many vaccines available. They started being available at the end of 2020, so it was less than a year, and we had vaccines, and that's record-breaking time that we've been able to identify these different pathogens and diseases, and have been able to make vaccines that can help. And I honestly think mRNA vaccines are going to change the way that they're here now, and I think they're certainly going to change the way that vaccines are developed in the future, and certainly going to allow for, I think, more vaccines and more more effective vaccines in the future. So this is a traditional vaccine development timeline here, and as you can see on the bottom, it breaks down a timeline. You see, 3 to 8 years is in the discovery and in the target phase, and you're looking at the preclinical data and trying to get the virus and trying to identify target sites for it, and then trying to replicate that and create multiple, say, target sites. That tends to take years and years and years of research and development trying to develop these different vaccines. Then after that, once it's developed and they seem to have something that they think can catch on, then it takes years and years before that gets into human trials, and then they'll look at phase 1 trials, phase 2 trials, and phase 3. This is where humans would start to be involved. So phase 1 trials involve looking at safety. They're going to use a very small population, and they're going to want to know, is this drug safe? Is there any severe side effects to the vaccine? Because if there is, they're not going to continue with the development. Once you hit phase 2, you're going to see a bit of a larger group, maybe 100 plus participants. And this is where they're still looking at safety. Safety always remains at the forefront, but then they're looking at the immunogenicity, which would mean, are the individuals in the trials, are they getting an immune response? Are their bodies making antibodies? Once we get to phase 3, they're still again looking at safety, but now they're looking at this immune response that people are getting. Is it effective in reducing the risk of getting the disease? And this is where they start to look at regulatory approval. So in terms of the COVID vaccine kind of development timeline, all of these steps were still used. Okay, that they did not skip any steps, and they did not skip out on the number of participants. Tens of thousands of people were involved in these trials, and how they kind of managed it was they started very early. So before March of last year, they were actually looking into developing these vaccines, and they found well, I can speak for the mRNA vaccine with the virus. They identified the genetic code in there, that mRNA part that causes the virus to make those spike proteins on the outside. And with that, they were able to develop these mRNA vaccines very quickly. And that really cut down on that, research and development stage at the beginning. Then with the phase 1, phase 2, and phase 3 trials, they overlapped them, and that allowed them to kind of move very quickly through these trials. They also started manufacturing these vaccines before regulatory approval was even given. So, by doing all these different techniques and getting, approval by the end of 2020 and into the beginning of 2021, they were able to develop these vaccines and get them to market and into people's arms, quicker than ever before. So looking at the COVID-19 immunization timeline for Newfoundland and Labrador, this was published back in, I believe, early April by Public Health, and it kind of outlines the route, or the route that we've been taking for vaccinating everyone in the province. So as you can see, there was a staggered approach, and it kind of addressed those at highest risk, which were our older adults, our older population, and that's because age seems to be one of the big main risk factors for severe complications of COVID-19. Then they also address those that would be at higher risk of severe disease, those at higher risk of getting COVID, those the healthcare workers, first responders, we have Indigenous adults, rotational workers, teachers, and as we stagger through, as of yesterday now, anyone 12 and up can register to get their COVID-19 vaccine. So things are moving along very well. Next week, Public Health will be administering vaccines, but pharmacies will also be getting involved, and this will increase access to immunizers so that more and more of the population can get vaccinated. This original timeline, as you can see, I'm just going to look at the bottom one here. As you can see, it said 16. So the big thing with COVID-19 is every single day things are changing. And, back then, the Pfizer vaccine was indicated for anyone 16 and up. So that's why it said 16. But it was recently, as of the early May, also approved for anyone between the ages of 12 and 15. So for that reason, now it's 12 and up kind of involved in this category. But we're a bit earlier in May than originally anticipated on this timeline. And the current target is that anyone that wants to receive the COVID-19 vaccine will be able to get their first dose, hopefully by Canada Day, which is a little bit ahead of the schedule that was originally proposed back in April. Okay, so since most people here on the call will have either received their vaccine or can register now, I wanted to talk a little bit about preparing for your vaccine day. So certainly it's very important to talk to your healthcare provider about any questions you may have about COVID-19 vaccines before your appointment. It's better to get those addressed right away, and certainly attend any webinars or any information sessions such as this one today, just to make sure that you're getting an informed decision. Or making an informed decision when you're choosing to get your vaccine. If you have allergies, I would recommend preparing a list of the names of what you're allergic to and bring them into your appointment. And this isn't just things like medications. This is anything that you're allergic to. So I'll just throw an example. If you had an allergy to polyethylene glycol, that's PEG. Some people may know PEG, or they may know it as Restoralax. It's a laxative. PEG is also found in some bowel prep. So that's actually an ingredient that's used in the Pfizer and Moderna, the mRNA vaccines. So if you did have that allergy, that would be a reason to get, the AstraZeneca or a different kind of vaccine that didn't have that ingredient. If you have an allergy to something called polysorbate 80, it's kind of these weird names you're seeing with these allergies, but that's an ingredient that's in some cosmetics, some skincare products, and that is an ingredient that's actually found in the AstraZeneca vaccine. So that would be a reason not to get that one. So that's certainly why I recommend writing out your allergies that you're aware of, not just the drug ones, anyone, and bring them to your appointment, or again, ask in advance about your allergies and which vaccines you can get. And certainly write down any other recent immunizations that you've received. So actually last week, in my practice, I had a patient come in to get a shingles vaccine, and I asked them if they had already booked their COVID-19 vaccine, and they had, and it was within a week of getting their shingles vaccine. So we made the decision that to prioritize their COVID vaccine over their shingles vaccine, because you can't have any vaccines administered to you 2 weeks before your COVID vaccine or 4 weeks after. There's no reason to believe that you can't receive them together. It's just because of the urgency and how quick the COVID vaccines have come out. There's been no research to look into any interactions with other vaccines. So just as a safety precaution, it's better to space out those vaccines either 2 weeks before your COVID shot or 4 weeks afterwards. Okay, so it's your vaccine appointment day, or V-Day, as Dr. Fitzgerald likes to call it. Make sure you bring your healthcare card. So in Newfoundland and Labrador, that would be your MGP. Wear a short sleeve. So as you can see in the photo in the background here, the injection is given in your upper arm, in your deltoid muscle. So either your left or your right, whichever one you prefer. And it's really convenient convenient for your healthcare worker that's giving you your shot, if they can have easy access to your arm. Okay. If you're feeling unwell that day, certainly follow all public health COVID-19 protocols. If you're feeling unwell or sick, or you have symptoms of COVID-19, certainly stay at home and call 811 to see how to proceed. But you wouldn't want to go in to get your vaccine if you're feeling unwell. You'd want to reschedule your appointment. And then after your vaccine, you're going to want to wait at least 15 minutes or longer, as specified by your immunizer, following your vaccine, just to be monitored for any possible reactions. So vaccine side effects, or common side effects, I don't really like the word side effects, because while it may be a side effect of the vaccine, it's really an adverse effect, as in your immune system giving you a response to your vaccine. The side effect itself would probably be the pain, the redness, the swelling that's in the arm that you get, and that's with any vaccine that you get. You are getting a needle that's going into your arm. So like a cup, you're going to expect to see some pain, some redness, swelling. That's just how your body responds. In terms of throughout the rest of your body, this is where you're going to see your immune response. Okay, you're going to feel a bit of tiredness, maybe some headache, muscle pain, chills, fever, nausea. This is, your body is responding to this vaccine being inserted, and it's creating these antibodies. It's creating a response, and while it's doing that, it's the same as if you were to get the virus. It's responding, and when your body responds, maybe it'll crank up the heat to try to kill the virus. These are the different mechanisms that your body takes, and when you get a vaccine, that's your body, that's your body and your immune system going to work to fight off this vaccine that's going in, and to prepare your immune system, so that when you come into contact with COVID, you've got a line of defense. So I usually tell people that it's good, it's good that you get side effects. I know when I got my vaccine last month, I had a bit of a sore arm, and I felt a bit tired, but that went away after a couple of days. And these symptoms are mild, and it's much more mild than actually getting COVID-19 itself. There are chances of rare adverse events from the vaccines that typically blood clots, of course, which we'll talk about in a moment, is a risk with some of the vaccines, but it is a very rare risk. Okay. Another type of reaction that you can get is an allergic reaction. So you should receive a sheet from your immunizer that talks about some severe, rare adverse reactions. So an allergic reaction could be some tightness in your throat, could be some swelling, could be swelling in your throat. So certainly keep an eye on these adverse reactions, but I would like to reiterate that they are rare side effects, or here I'm saying side effects, but adverse events from the vaccines. So following your vaccination, continue to follow COVID-19 public health precautions. So, we're still going to want to be wearing a mask in public. We're still going to want to be washing our hands diligently. We're still going to want to be continuing social distancing, okay? On your appointment day, you will schedule your second dose. Typically, it's about 4 months down the road that we're doing in Canada, but make sure that you keep track of that date. Put it in your calendar, put it in your phone as a reminder. And if it comes closer to that date in August or in September or October that you're unable to make your appointment, call public health or call your pharmacy to let them know, and get that date rescheduled. And like we mentioned earlier, monitoring for adverse effects is very important. Okay, so this actually came out last week from the Public Health Agency of Canada, and it's kind of like a blueprint for what to expect, all across Canada. Of course, this will vary based on region to region, and will vary based on the percents of the population that are vaccinated. So right now we're still in the spring. Cases are high, and vaccine coverage is low. So we want to continue to follow public health protocols. More people will need to be vaccinated in order for restrictions to be lifted. I really like this point here. It talks about reaching out to help friends, family, or neighbors who might need help with booking or getting to a vaccination appointment. So this is really important. If you have a neighbor or if you have a friend that may not have access to the internet and they haven't booked their appointment yet, certainly encourage them to get their vaccine. Maybe have a discussion with them, and it's a really good to have open dialogue about getting vaccines. And you might be able to get them a number, or you might be able to help them with registering online. Some people might be in your extended bubble and may need rides to these vaccine clinics. And if you're able to help, get other people vaccinated, that not only helps protect them, but that helps protect you and your community. So come the summer, when cases are hopefully lower and vaccine coverage is high, and they define this as if 75% of those eligible for vaccine have one dose and 20% have a second dose, then some restrictions may be able to lift, but we'll still be maintaining, physical distancing and wearing a mask. But, we can look forward to more small outdoor gatherings with family and friends, but likely crowd events we'll still want to be avoiding. So come the fall, cases will hopefully be low, and the two-dose vaccine coverage will be high. So what they're saying here is if 75% of those eligible for vaccine have received the full COVID-19 vaccine series, then local public health restrictions will be able to lift more of their measures. And we might be able to do more indoor activities with people outside of our bubble. The key thing to note, though, and to be realistic, is COVID-19 will still exist, okay? And we will still have to follow some public health measures. But this kind of gives us a light that hopefully more indoor activities with more people will be able to happen, come the fall once more people get their vaccine. So. So talking about that, 75%, that's not everybody. So why is it that not everyone wants to get a vaccine? That's a term called or coined vaccine hesitancy by the World Health Organization. And actually, before COVID-19 started in 2019, the World Health Organization, or the WHO, declared vaccine hesitancy as one of the top 10 threats to global health. So, we have all this technology in place now that's able to help our bodies to build these defenses so that we can overcome the virus that if we come in contact to it. But why aren't people getting the vaccine? Some of the most common questions that I hear, or reasons why people may feel, uncomfortable about getting the vaccines is, they're wondering, are these vaccines safe? So in order for these vaccines to come into the public, they have to undergo, very rigorous clinical studies. There's the phase 1 trials, phase 2, 3, like I talked about earlier, and they're continuously looking at safety. As they come out into the public, once millions and millions of people are getting the vaccine, that's where we can identify these very rare adverse reactions that are, say, 1 in a million or 1 in 100,000. So you should look at it as people have already undergone or have already taken the vaccine, and most adverse reactions have been identified so far. Of course, there may be more, but I will say it is very unlikely. Once the vaccine enters your body, especially looking at the mRNA vaccine, it's the messenger. It gives your body a message. Once the message is delivered, that's broken down and that leaves your body. Okay, it's gone. What you're left with long term is this immune response that your body builds up. I certainly like when patients ask questions about the long-term safety of vaccines. They're kind of looking at it like medications. And I would always want, if I was taking a medication long-term, I would certainly want to know what the long-term side effects are of it. But a vaccine is something that you're receiving as, well, 1 dose or 2 doses in this case with the current vaccine series. But again, it comes into your body, it goes into your cells, it delivers the message, and then it's broken down very quickly and eliminated from your body. So it doesn't stay around very long. And really, the long-term side effects should be identified by roughly 6 to 8 weeks after you receive a vaccine. And these vaccines have been out now for roughly almost half a year now. So it's a very natural question to have about the safety of vaccines. But we have, we have millions of people have had this vaccine now, and we should have identified any reason to, believe it to not be unsafe. And if it was unsafe, it would not pass regulatory approval or would be pulled. Okay, if the lack of benefit, if there was lack of benefit there and there was more harms than good, it wouldn't still be administered into people's arms. Okay. And again, with long-term data, we don't necessarily have the long-term data on it, but really what we're looking at long-term is the efficacy, okay? We don't know if these vaccines are going to provide us with a long-term, immune response and effectiveness. And that's something that we're just going to have to, we're just going to have to learn. We don't have the answers right now. And as time goes on, we will know more information about these vaccines and how long they're going to stay effective. Another common thing I hear about is, or question I hear is, do I really need this vaccine? Like, I don't know anyone that's gotten COVID-19. The cases are low. Like, do I really need to get the vaccine? And the answer is yes. We saw firsthand in Newfoundland and Labrador how quick things can change overnight. In February, we had the B.1.1.7 variant that, kind of exploded overnight, and we had to go back into alert level 5. And certainly that can happen again. That can happen tomorrow. So you need to protect yourself, and do this as a preventative or as a precaution to protect your body, not just your body, but anyone around you from getting COVID-19. The other big concern that we often hear, and it's very, it's natural to have concerns about the vaccines, especially when you're hearing about vaccine or these vaccine blood clots, or the big name for it would be vaccine-induced immune thrombotic thrombocytopenia, or VIT for short. This is an immune response that our body has to the viral vector vaccines that we receive. Okay, the mechanism itself is believed to be a immune response with our antibodies. It's not a typical blood clot that we get, like when we think about, say, a clot in our lung or a clot in our leg. This one is an immune response that we can receive. It is a rare side effect of the vaccine, such as the AstraZeneca vaccine, these viral vector or adenovirus vaccines. But there is a small risk that's been identified with them. So this slide is from Thrombosis Canada, and it kind of puts COVID-19 vaccines and blood clots risk into perspective. So, the AstraZeneca vaccine is believed to be 10 in 1 million or 1 in 100,000. I've heard, estimates of 1 in every 50,000, so that would be 20 in 1 million. And I've heard as low as 1 in 1 in every 500,000 people. So the percents will vary, but we'll just argue 10 in a million, or even 20 in a million. So if you compare that to birth control pills, that's just a fraction of the risk factors of people that get blood clots with birth control pills versus the AstraZeneca vaccine. If you look at the average Canadian and just our natural risk of getting a blood clot, it's much less. It's a fraction of just the natural risk we have of just living and getting a blood clot. 1,290 in a million versus 10 in a million or 20 in a million. I think the big number on this slide to look at is hospitalized COVID-19 infections. Okay, so you can get COVID-19 and be hospitalized, and your risk of getting a blood clot is 14.7%. 14.7%. Put that into perspective to 0.001%. That's way bigger than your risk of a blood clot with AstraZeneca vaccine. So, not only are you getting the AstraZeneca vaccine to protect you from COVID-19, but you're also getting it to protect you from the other, adverse effects of COVID-19, which could include a blood clot. I've heard of people having this brain fog after they've gotten COVID-19. Some people have gotten lung damage and they're having trouble breathing months after having COVID-19. I'm even hearing people having a loss of smell, a loss of taste. So, there's so many risks associated with COVID-19. We don't really know what the long-term complications of COVID-19 are yet, right? So, looking at the blood clots, to me, it's a very clear decision when you're looking at the benefits versus the harms of these vaccines and what they can protect you against. I just have another slide just to talk about the AstraZeneca vaccine. This is from the United Kingdom, and it was based on data back in March when they were looking at the potential benefits and harms of the AstraZeneca COVID-19 vaccine. And when you're looking at the benefits, of course, as you're in an older age group, the benefits of the vaccine are higher because your risk factors when you're in an older age group is higher for worse disease with COVID-19. Okay, in terms of the potential harms, again, when you look at it as a kind of a ratio of benefit to harm risk, to me it's very clear that especially if you're an older adult, that the benefits of the AstraZeneca vaccine outweigh the harm. So if we're looking here at the age group of less than 30, this is kind of where the harms may outweigh the benefits, and that's why in Canada these vaccines are only recommended right now for 30 plus. In saying that, it's 30 plus across Canada, but each province has says what the age group is for that individual province, so it may vary based on province. But certainly looking at the risks and versus the benefits is what you should do when making an informed decision. And certainly, talk to healthcare providers. We're definitely there, and we're ready to answer any questions that you may have about the vaccine. So we've talked about the virus and kind of how our immune system makes a response. How to prepare for our injections, what to expect on the day. But why should you get a vaccine? And the main thing I could say is you want to protect yourself, but you also want to protect those around you. You want to protect your loved ones, you want to protect your friends, and you want to protect your community. So, if only a few people are getting vaccinated, then one infected person with the disease can cause it to travel very fast. So I'm assuming this is a group of people that are not socially distancing and not wearing a mask. So as you can see, it can spread pretty easily. But if a lot of people are vaccinated, then the disease can't spread very far. So the whole community stays safe. And this is called herd immunity, or community immunity, community protection kind of thing. We're all kind of doing our part to get vaccinated and to protect others, because not everyone can get vaccinated. There are going to be people that can't get vaccinated. And there are people that are going to get vaccinated but not get the same immune response if they have a weakened immune system. So we need to protect ourselves, but also protect these people. So registration for your immunization, you can visit the public health website. Newfoundland Labrador website has a lot of great information. It's very convenient to book online. And you can also use a contact number to contact your health authority. So you would contact it based on if you're in Western Health, Labrador Grenville, Central Health, or Eastern Health. You can also contact your local pharmacy. So not all pharmacies will be providing COVID-19 immunizations, but many will. They wouldn't have their doses yet, but certainly you can contact your local pharmacy with questions and see if they'll be providing the immunizations. So in the words of our Chief Medical Officer of Health, hold fast, Newfoundland, don't let our guard down. We've done a great job so far with maintaining social distancing and doing our part. And the next big step now is to get vaccinated and to not just protect ourselves, but protect others from the virus. Here are some references, and I think we'll jump into the questions now.
We are indeed going to jump into the questions now. Thank you so much, Jeremy. You've covered a huge amount of information and really, really important. We had one of the attendees said, this is an excellent presentation. Everyone in Canada should see this. So that's a great thing to know. It's now 1:51. Jeremy has indicated that he can stay a little bit after 2 to answer questions. So if those of you who are watching have to leave, that's okay, but we will continue to ask Jeremy some questions after 2 o'clock. So let's just jump right in right now. Yalan was asking, in many countries, they let people choose which COVID-19 vaccine they want to get. Why are we not allowed this privilege in Canada?
Yeah, so certainly you do have a choice in Canada. Like, you're not going to have a healthcare provider, poke you with any vaccine. I do recommend getting the first one that's available to you, but I will say we are very privileged in Canada to have these vaccines, multiple vaccines available that we can choose from. There are a lot of places in the world that, they would love to have these vaccines now, any of the vaccines, and get them. So, we still do have a choice in Canada which vaccine we're getting, Moderna, Pfizer, or AstraZeneca. It might be that the one available for you right now, there's only one option, but certainly, you can defer which vaccine you get. You don't need to get that right now, but I would recommend you get the one that's first available for you to get that protection now.
Great. Bonnie says, it sounds like the viral vector vaccines are similar to the annual flu vaccine. Is that correct? And she's also wondering what the difference is between AstraZeneca and COVID Shield, if I pronounced that correctly.
Yeah. So the viral vector vaccines are kind of more like our traditional vaccines. They are a bit of a newer technology, but they are more like the traditional vaccines that we've seen. With the AstraZeneca COVID Shield, so they kind of work together, these two companies, COVID Shield and AstraZeneca, designing their vaccine. It's just we've kind of dropped off that second name and we just shortened it to like the AZ vaccine or AstraZeneca. Same with the Pfizer BioNTech. You basically just hear, Pfizer, and same with Janssen or Johnson & Johnson. They're kind of interchangeable, but it seems like AstraZeneca has definitely taken over the conversation a lot more than COVID Shield has.
Okay, now, why may 2 doses be required? What are the advantages and disadvantages of having a different vaccine for each dose?
That's a really good question, actually. So the purpose of the 2 vaccines is to improve the immune response. So many vaccines that you'll see that you get, in the public health vaccination schedule, it's multi-dose, and the reason for that is when you're first exposed to the virus or to the vaccine, your body learns how to create antibodies and an immune response, but it's typically not a very strong response. And that's why when you receive the second vaccine, your body's already identified it before. It already has kind of like this army built up. Sometimes people like to look at it as an army, but when you get that second exposure, that's when you really see this greater effect in our immune response, and we get a lot stronger defense, so that we get more antibodies build up, and that way if we do come into contact with COVID-19, we have a better protection. The second part of the question about mixing vaccines, there's certainly a lot of interest in that right now. My understanding is in the United Kingdom, there's currently some studies going on about mixing Pfizer and AstraZeneca. So some people receive Pfizer first and then their AstraZeneca dose. Some people receive the AstraZeneca dose first and then the Pfizer vaccine. The data isn't completely out and published on that yet, but my understanding is there was a bit of there's more reactions in the body when you're receiving 2 different vaccines, and that's because they have different mechanisms, and your body has to kind of respond to it a bit differently. So because there's more reactions, there's of course more side effects, and again, I'm using the term side effects, but that's your immune system having that response to the vaccine. So there isn't a clear answer on that yet, if it's going to be recommended to receive the 2 different vaccines. But I do expect that as the days go on and more information comes out, that we'll probably have more clear data on it, and then public health will make a decision on it at that time. We are approaching, some people are getting their first doses now and in the coming months, but there are going to be people now that got their doses back in, March. So they're going to be getting a second dose, in June or maybe in July. And by then I expect, public health to have a statement on that, and we'll know which direction they're going to go.
Okay, here's a question. Are there people who are medically unable to get one of the vaccines?
It is possible that you may be unable to get a vaccine. It would depend on certain risk factors with your health. Certainly talk to your family doctor about that, but there may be people that can't receive a vaccine. I'm just thinking of one clear example. If you had an allergy to ingredients in both vaccines, that would be a reason why, or both different types of vaccines, then that would be a reason why you can't get vaccinated.
Okay. Um, a vaccine, here's a fantastic question, I think. A vaccine is the final step in a pandemic. What needs to be done to reduce the likelihood of future pandemics? What are the principal agencies, public and private, who are focused on prevention?
Yeah, that's actually a fantastic question. Actually, if you if you actually do a quick YouTube search, you'll find a TED Talk. I think it's either Barack Obama or Bill Gates talking about this in I think 2016. And to me, it's kind of crazy that, I think public health has been saying for years that, there can be a big pandemic soon. We had SARS, we had Ebola, there's been all these viruses in recent years, H1N1, but no virus has really spread as fast as COVID-19 has. It's a very easily transmissible virus. And I think, looking forward, I think mRNA vaccines are certainly going to be a great tool in our toolkit to protect us from these diseases that will come in the future. But there certainly are going to have to be other precautions taken. Like a quicker response. Like this virus was identified in December 2019, and a global pandemic was not declared until March 2020. That's a 3 month gap, or 2.5 months that it was, and there was a delay in moving on this. And I think quicker lockdowns or quicker public health responses will be needed in the future. And I think it may have taken this for public health's stance on it to be taken seriously. And we are going to see changes, I think, in the future to how we respond to these types of situations. And also to touch on the vaccine part, the vaccines are a huge part to getting through this pandemic. And we're still going to have to be following these public health protocols, going forward. But certainly, we are very fortunate about the advancements in science that has allowed us to have vaccines this early, and to help get through it. I think the early estimates was 18 months before we would or get vaccines. Like that, we're doing great, I think, with the vaccines that have been approved, and the fact that there's so many. There's currently 4 approved in Canada, but there are many more around the world. So it's really amazing and incredible how science has allowed us to protect ourselves.
Absolutely. It's wonderful to reinforce that positive message, isn't it? That it's amazing that we do have the vaccine so relatively quickly. A question from Kathy. When we received our first dose, the appointment for our second dose was made. Have you heard whether the date for our second dose might be moved up if the receipt of vaccines ramp up?
Yes, so that's a really good question. So I know my vaccine is, I think, for sometime in August. But what do we do in this window period of time that, just say if everyone's vaccinated by the first week in July, like, are we not going to administer vaccines for a few weeks until people start gearing up for their second dose? It's really too hard to tell. There's been no information out about it, but the original NACI guidelines that came out that talked about postponing that second dose to 16 weeks so that everyone would get a first dose quickly and everyone would get some form of immune response. It does outline in there that once everyone does get their dose, it may be pushed ahead. And there is more research going into the spacing intervals. And I believe something last week, there was a study that talked about anyone 80 plus that was receiving a dose in a 12-week period versus the 14 that we currently have. And it appeared there may be more response. It's not clear yet. There's still more data that needs to be analyzed and come out from it. And again, that's for an 80 plus population. But it's a bit early to tell yet, but that may be something that may happen. We may come in July and they may say, look, the first doses are given, like we're ready to go with the second doses. We have a sufficient supply. If you've had 12 weeks, maybe then we'll give the dose. But certainly that's another thing we're just going to have to wait and see and see what we learn over the next few weeks and months.
Absolutely. Here's another great question. Let's say we have a good vaccine uptake here in Newfoundland and Labrador, and the vaccine appears to provide good protection from severe disease and hospitalization. What do we do if we have another outbreak? Will a lockdown still be necessary? Why?
Yeah, so So that's another really good question about an outbreak. So my hopes is that once everyone gets their 2 doses and gets sufficiently protected. So again, sufficiently protected in the sense that once you get your second dose, 2 weeks after that final dose is when you should get the full benefit of the vaccine. So my hopes then is that cases we shouldn't have to go into these full lockdowns. We may have to continue following these protocols, but I haven't read anything in place for what will happen once we get to that stage. So I can't comment really on what our response will be then. It's just my hopes that once we get vaccinated, there hopefully won't be these outbreaks anymore. And that goes to show, if you're looking around the world, like different places, different countries are ahead of schedule than we are in Canada, and have more individuals vaccinated, and they have seen cases go down as a general rule of thumb. So hopefully we'll see that in Canada as most of the country gets vaccinated. I think the main thing to look at though is, a vaccine hesitancy. Talk to other people, have a conversation about getting a vaccine, change your Facebook picture to "I got my vaccine," certainly encourage people to get vaccinated. The more people we can get vaccinated, the better control we can get on this disease.
Absolutely. And once we post the recording of this event, you could actually share this event with those people that you might know who have vaccine hesitancy, and which hopefully can alleviate some of their concerns. Quick question here. Do we need to fast on vaccination day? Is that necessary?
Nope. So you can just live your life regularly after get off work or anything like that. Go get your vaccine. You don't need to fast or anything for the vaccine.
Okay. Um, and the last question I have, I think, if anyone else out there has one, please post it, is someone has a friend in the US who says that the second dose of Moderna had been told that it should be given between 3 and 7 weeks from the first dose. However, Newfoundland and Labrador plans to give the second dose 4 months after the first dose. Which one is correct?
Hmm. So how the vaccine was studied was certainly what your friend in the US would have said. Like, it was studied, I believe, either 21 days or 28. I can't remember. There's differences between each one. But that was the spacing window they used. And I'll be honest, I believe that was the spacing window because there was such a pressure on time. And they knew they needed 2 doses to get that full response. So they went with a 21 kind of day spacing or a 28-day spacing to kind of see the response that your body would get. Canada, not just Newfoundland and Labrador, but Canada has taken the approach of spacing the first dose from the second dose. And I believe the main reason for that was because of supply issues. Okay, so because of supply issues, NACI, the federal guidelines that we're looking at, it kind of looked at, to us, typically vaccines are spaced a bit more further apart, and the longer you wait between vaccines, typically the more response that your body will kind of gives the vaccine. So I guess they kind of went out on a limb a few months ago and decided that we were going to space the doses to kind of get at least 1 dose into most of the population, at least get some antibodies in everybody, and then get that second dose. So in terms of what's the best thing to do, we do follow what NACI recommends and Health Canada, and we do follow that. And I think we're going to see information coming out about the difference in the responses, and what it looks like in that study that I mentioned earlier about spacing it by 12 weeks. It looks like that may actually give a better response than the shorter window in between. But again, we'll know more about that in the coming weeks or coming months.
And finally, our last question from Jill. She wants to know what you think of the CDC's messaging that vaccinated people no longer need to wear masks when gathering inside.
Yeah, I really don't like that messaging. I'll be 100% honest. It's going to cause a lot of confusion, I think. Right now, the US doesn't even have 50% of its population with 2 doses, okay? I'm just going to go back in my slides here, just one moment, and just show you this, the approach that Health Canada wants to take. So you can see here in the fall, they're saying if 75% of those eligible for vaccine have received at least the full dose, the full vaccine series. So, less than 50 is not even 2/3 of where we would be at before we'd start lifting our restrictions. And, to me, it's a bit early, and that relies a lot on a trust system. There's nothing going to be, on us saying, hey, I got 2 doses. We're not going to have, a little tattoo on our forehead saying that, so that people know that they got the 2 doses. So, you know, if you get 2 doses, they're saying that you're protected, and there's benefit to it, but, there's still going to be people around you that are not vaccinated, either with 1 dose or 2 doses. And to me, it's a bit too early. You obviously had to make a decision as an individual once public health does lift the restrictions here in Canada and here in Newfoundland. And whatever you're comfortable with, certainly do that. If you're wearing a mask, wear a mask. If you're not wearing a mask and you're comfortable with that, and most of the population's vaccinated, then do that. And we need to be kind to each other, and not judge each other based on what we're comfortable with, and what we're doing in terms of our safety precautions. But I think the CDC messaging is a bit early, and I believe more of the population in the United States should get vaccinated, because not everyone's vaccinated, and they can see cases rise. And I think it's better to take a precautious approach, than to jump head first, and hope you don't sink. So
Yeah, absolutely. Okay, well, listen, we are now at 8 minutes after 2, and I think we're done with the questions now. So I really would like to sincerely thank you, Jeremy. Thank you so much for sharing your time and your expertise with us. Everyone is just very, very pleased with the information that you've presented, and is very thankful to have attended. Do you have any final thoughts that you'd like to leave our audience with on this?
Final thoughts. Well, certainly, I definitely am pro-vaccine, and encourage you to get your vaccine if you're eligible to get it. Certainly after you get off this call today, go on the public health website, book your appointment, or contact your pharmacy to, maybe get on a wait list to get your vaccine. But it's really important that we all, work together, hold fast, and we'll get through this pandemic.
Absolutely. So thanks again. I think we've all learned a lot today. I know I have. And thank you to everyone who attended for your wonderful questions. If you enjoyed today's event, we have several other events coming up in May, and they're listed there on the final slide. You can register for those at our alumni website. And as I indicated earlier, this session has been recorded, and I will be sharing a link in an upcoming email with all of those of you who have registered, so you'll be able to see the event in its entirety and share it with your friends and family. Once again, I'd like to thank Jeremy for his amazing presentation, and thank you so much to everyone who participated. And that'll be it. Thanks so much.
Thank you.